just take it off now. Does anyone know how to take? Got it. Right, sorry about that. Yes, live and direct on Instagram and on Facebook. Q&A with yours truly, JJ Staiano. I used to be able to put that on the screen, didn't I? Don't even do that anymore. Okay, well, never mind. That's who I am. Plastic surgeon extraordinaire. If you've got any questions, then please feel free to ask away. Today, difference between round and teardrop implants, tattoo removal, combined surgery comes up a lot. That maximum time for surgery, why I don't do rhinoplasty, and have I got a botched boob job? Question mark, not, obviously. So we're going to kick off tonight's show with this question here, unless anyone has got a question. Khan's on Facebook and has actually said hello, which makes me realize that Facebook's working, which is good. Thank you, Khan. Good to see you. Answered this last week and the audio went all funny, and I think it's my internet. I've got to be honest with you. I think I'm fully to blame. I think my internet is I know my internet is hopeless, so apologies for that. So I hope the audio is not all cutting out all over the place. Obviously I'm just talking away. I'm assuming it's all okay, blissfully ignorant. So we'll see how we get on this time with answering that question. I'm sorry if you were here last week and you heard me answer teardrop implants. Yeah, so basically in terms of implants, those are the two choices in terms of shape, round. And first thing I say to you, it doesn't matter that much. To be honest with you, people get into such a tizzy about what implants they're going to have, and it doesn't matter that much. Bit crackly, says Khan. Oh, is the audio going to be crackly with this one as well? Oh, is it this? I've got an idea, Khan. I have got an idea. What? So hello. So that microphone, I'm going to change my. Hello. Right, I've changed microphones on Facebook. I don't know if that's going to be better. I've got this big fancy microphone. I don't even see it. Massive, great thing. Flipping. Okay, well, is that less crackly? Well, I'm going to crack on. So, take two. What's the difference between round and teardrop implants? Right, well, I'm glad you asked me that question. The answer is not that much, is the simple answer. And the other thing I would say to you is don't worry too much about implants. People get into terrible twists and turns and tie themselves into knots as to which implant they should have. You see them all the time on forums saying, should I have a 320 or should I have a 380 or whatever, and it actually doesn't matter that much. I think the most important thing when you're looking at having a breast augmentation is the surgeon, and I think you should spend time choosing your surgeon. I think it's fine to see a few surgeons. I think it's fine to try and get a feel for different surgeons. We all acknowledge that people having this sort of surgery will see several surgeons. There's no problem with that. I encourage people to see, well, maybe not encourage. I do encourage people to see other people. It's fine. It's a luxury purchase, and you can sort of shop around. It's not an emergency operation, so you've got time to consider. So I think that is the most important thing. Having said that, there is a difference between round and teardrop implants. Now, there are some surgeons out there who don't use teardrop implants because they said round implants that go when they're in the body will go teardroppy shape. I do use round teardrop implants, so I'm not like that. But having said that, it's a valid point, and I think it is difficult to tell the difference, and it's actually been shown in studies where they've shown plastic surgeons patients who are before and after and said, oh, they've got round or teardrop, and basically they get it wrong. So it is not that cut and dried. It's not like round or fake, teardrop and natural, because they come in different profiles. They come low, medium, high, extra high profile, and so it's the profile that matters as much as the shape. and the width actually is the most important thing. But anyway, so it's the profile that's really important, and also matching it in with your body shape. So, but broadly speaking, a teardrop implant is less full in the upper pole than a round implant. So that is the difference between round and teardrop implants. And more fullness in the upper pole is associated with a more fake look. So in that respect, you can understand why people will say that teardrop implants are natural. You know, there's no question they are less full in the upper pole and therefore can deliver a more natural result. Having said that, if you have a bit of breast tissue, the way teardrop implants are really useful in my hands is when someone's got no breast tissue. We've got no or very little breast tissue. I think a teardrop implant's really good because that delivers the shape to the breast. But if you have got some breast tissue, particularly if you've got breast tissue sitting in the lower part of your breast, then sometimes a round implant can actually balance out and give a bit of a projection to the upper pole as well as the lower pole, and you can get a natural result with a lower round implant, as long as you're not getting up into the sort of extra high profiles, etc. Well, it depends on how much breast tissue you've got. You can still get a natural result even with those implants if you've got a lot of breast tissue. So it's really important when someone's got very little breast tissue. That's when teardrop implants come in. When you've got some breast tissue, particularly if it's sitting a bit lower on your breast, then I think you can get a natural result with a round implant. And the other benefit of a round implant is you don't have the problem with rotation. So that is a benefit right there. So yeah, in my hands, and we're all different, you know, as I say, some people don't use teardrops, sometimes people might use a lot of teardrops. So we're all different, so we've got our own experiences, but that's where I am on that one. So Khan, that's better, is it? That's better. That's the microphone on the webcam, Khan. So not a big fancy one. Here you go, just shows you. Olivia's in the house. Good evening, Olivia. Right, got a question here now, which says, why will my tattoo take 1 to 2 sessions? Now, I have actually got it off pat how to get photos, both on Facebook and on Instagram. And I'm going to show it in Facebook now. It's a tattoo on the ribs. I can't show it on Instagram, so I'm going to have to do the unprofessional thing of that. Can you see it? You see it? Can you see it? It's not very good, is it? I accept it. Anyway, sorry. It's basically a tattoo here along the ribs. Interesting, this one. Interesting. Because I'm not. So what we do when you have a tattoo, we encourage people to send in photos, and we'll give you an idea whether it's a goer or not, because sometimes they're huge things all over the arm, you know, sleeve and stuff like that, in which case we can't remove those, and we could see it good. Excellent. So we can tell you whether it's a go, and we can give you an idea of how much it'll cost and how many operations it'll take to save you having to come to the clinic, to save you having to come for a consultation. I don't think I've seen this tattoo. So someone in the clinic, someone has obviously said it'll take 1 to 2 sessions, and then the patients obviously ask why, and then I've got to answer the question. I'm not sure whether I would say that would take, well, actually 1 to 2, yeah, it will take 1 to 2 sessions. I think that might come out in one. I think that might come out in one, but it'll be tight. And sometimes you do it with a very minimal margin, and you're left with a bit of ink on either side of the scar, in which case you might need another session to completely remove it. But I think you could have a good go at removing all of that in one session. It's difficult because I tell you what, you people, you're often sending photos way too close up. This one's arguably a bit close up. I think I can see, I think that's a breast coming into view. So I think it's sort of on the ribs. So a little bit, you know, if you're showing a photo, sometimes I don't know if it's an arm, if it's a leg, if it's a back, you know, so if you could see, when you're sending photos, if you can do them a little bit zoomed out, you know, ideally 2, zoomed out and zoomed in would be great. But yeah, this one I'm going to say I think we'd have a good go at it in one go, although there might be a hint of ink on either side of the scar. But you know, if you really wanted it all gone, it might need another one. But I think you'd be pretty happy with one session on that one, actually, personally. But it's all down to how much skin laxity there is. I think it will be tight with one go, no question. It is quite wide, but I think we could do that. So yeah, I hope that's answered that question. Yeah. BTW, if you have a question, feel free to post it. You know, feel free. 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 Feel I'm not saying that I haven't got enough questions organically. I have, obviously, but you know, I can't help but feel sometimes, I don't know if you're a regular viewer, but I can't help but feel, have I not answered these questions? Are these questions, did I not? Maybe it's just me. Maybe it's just me. But anyway, look, Kim and Family's asked a question. Not only that, she's asked a question with the hashtag Ask JJ. Right, I'm going to do Kim's question now because I'll come back to that one. Hashtag Ask JJ. This is Kim on Instagram. Hashtag Ask JJ. What aftercare do you give, please? Does it differ based on procedures? Seen someone offering only 6 months aftercare after a tummy tuck, but I thought it takes a lot longer than that to heal. Good question, Kim. And aftercare is one of those ones where it's a bit confusing. It's a bit like warranty of implants. It's not very clear. People say, oh, you got lifetime warranty of implants, or you got lifetime aftercare, or things like that. You got to drill down to what's included in the aftercare, because there's different elements to the aftercare, Kim. So let's take a tummy tuck as an example. So in terms of the aftercare, one of the things that I've built my clinic on is the aftercare. And one of the things I stress to patients, in fact, actually every patient, every procedure, doesn't matter what you have done at the clinic, we never discharge anyone. So if you've ever got a problem at any time, you can give us a ring, you can send us an email, you can come back to the clinic, you can, you know, we will see you and we will, you know, talk to you about what's going on and give you advice and help you out, because I am all about getting happy patients. That's what my clinic is built on. That's what the practice is built on. And that is because we look after people. And so in terms of coming back to clinic and having an appointment to see me or one of the surgeons, that is unlimited for as long as you want. But you might say, well, hold on a minute, what if I need another operation, which is obviously the big thing. So again, it depends what you need. So if you need something minor, like for instance, a seroma drained or something like that, we can do that at the clinic, no problem at all. The problem comes when we have to do something at the hospital. So when we have to do something in the hospital, like for instance, well, what could I think with a tummy tuck? Not even a dog ear we can do at the clinic. Scar's too high, and we have to lower the scar. That can be quite a major undertaking. So let's just say that one. So basically, you have to do something in the hospital. Then the hospitals offer different aftercares in terms of revision policies. So it's usually 6 months to 12 months, depending on the hospital. And you're absolutely right. It does take longer than that to sort of heal or settle, which I feel uncomfortable with the 6 month one. So sometimes what we'll say is, look, the scar's a little bit higher, 6 months. We'll put a revision in at the hospital, and we'll say to the patient, look, can we see you in 3 months' time? Because I think it might settle, because it's often a bit pulled up at 6 months, and it can take 12 or 18 months for it to settle. So I would rather they had longer policies. I'd rather they had, you know, 12 months at least. So Spire does have 12 months, but so Candy's got a question. Look at that, Candy. Ask JJ hashtag, please. So yeah, so that's talking about revision for 6 months. Well, I said that's talking about revision. You also seen someone. Yeah, well, I don't know. Some doctors will sort of discharge you after a certain period of time, or just offer one follow-up appointment and stuff like that. But that's not what I'm about. I'm about as many follow-up appointments as you want / need. See you as often as you want, and try and make sure you feel looked after. But and yeah, so the revision policy is often 6 to 12 months, but and if it's not settled, what we'll do is we'll put a revision policy, revision request in before the 6 month is up, and then review you, because it usually takes a year or more for it to properly settle. You're absolutely right. Right, Candice has asked JJ, thank you for that. I can answer your question now. I would have answered anyway. We just got to get it trending, you see. You know, that's how we get it trending, because that's like twice now we've had the Ask JJ hashtag, so I'm sure that's got to be up in the figures of Instagram. Are you offering Botox to the clinic? Yes, Candice, we are. Well, when you say you, not me, I don't do it. I'm not. It's not my thing. You know, it is not my thing. I don't know. I know what you're going to say. You got to do it. It's really good, and you know, loads of people want it, and everyone says it. And other people with clinics say, oh my God, you don't do Botox. Anyway, I don't, all right? I don't do Botox. I don't really do faces. I mean, I do moles and things, but I don't do facelifts and oh yeah, here we go. Yes, do it. You know, I feel, I know it sounds a bit, it might sound a bit weird. I just feel that breast and body is my thing. And facial aesthetics isn't. I don't do blepharoplasties or rhinoplasties or, you know, facelifts and stuff like that. And so I don't. Anyway, but people do. We got people. I know a man who does. So we got people at the clinic who do. So yes, you'd be more than welcome to come to the clinic to have it done. But on a personal level, it's not. I know it's a good, because it's much better business than this breast stuff that I do, because it's repeat business, isn't it? Breast stuff I do is a one-off, and like I just said a minute ago, follow up people forever, never charge. Really bad business, that is. Bad business. Where did I go wrong with my business choices? Anyway, don't worry about me. I'll be all right. You know, I'll struggle through. But yes, it is not a particularly good business model doing the breasty stuff that I do. But I'm basing it on a business model of trying to be really good at something, basically. And breast and body is where I'm focusing my life. So, God, Johnny Rambler, best answer ever. Thank you, Kim. You're welcome. Ask JJ. Kim's gone 2 Ask JJs in the same, you know, blink of an eye. Are you doing Zoom or phone consultations, please? I keep getting drawn back to you. Ooh. Yes, I am. Yes, I am. Both doing Zoom and phone. Well, it's not Zoom. It's like a software on the practice management software has got a video consultation facility. So yes, we are, Kim. I'm doing video consultations. I'm doing phone consultations. I'm doing real life consultations. The lot. You name it, I'm doing it. Yeah. You name it. What's going on? Nikki says hello, good evening, and I'm going to say hello, good evening to you, Nikki. And Celie says hashtag Ask JJ. Evening, dude, looking fresh. It's the baldness. I said to my wife, just get it off. Get it off, because it keeps on growing back. So so it's all gone. Jason Statham, yeah, that's what I asked for. Do you have Botox? Look at that. We've got another question. 2 questions. God, where have I gone wrong? I'm going to have to change my mind, aren't I, and start doing Botox and then delete this live video and deny that I ever said that I wasn't interested in doing Botox. Just kidding. Okay, just kidding. But seriously, I'm struggling in my groups to find a decent mummy makeover that includes mounds. Is this standard or separate procedure? It's all about the Botox. It is all about the Botox. I think I am worried I'm backing the wrong horse, Candice. I really am. What can I do? When you get to my age, you know, you can't. Oh dear, am I going to look back on my life and say, oh, if I'd done the Botox, I'd be rich. Anyway, there you go. Sorry, Celie. You're asking for a decent mummy makeover that includes mounds. Mounds. I can only assume you're talking about the mons, the sort of bit where the pubic hair is. That can only. Where else could you have mounds on a mummy makeover? It must be that bit. So having said specializes in breast and body, didn't know what she's on about with the mounds. So let's just work with that. So let's just say it's the mons area. Yes, you can do stuff to the mound, to the mons area at the time of a tummy tuck, but you are limited as to how much you can do. So in a massive weight loss patient, Celie, if you've got a massive weight loss patient with a huge ptotic mons, meaning there's a lot of spare skin, there's a lot of laxity in that mons area. The problem is, number one, patients often don't realize it because their abdominal apron is hiding it, so they can't see that mons, so you have to point it out. And number two, you can't really address it. You can't really have a good proper go at it at the time of a tummy tuck. It does, if it's a really proper, very totic mons, it would need a separate procedure, so-called monsplasty. So it would need a separate procedure to remove that skin and tighten that skin, because you wouldn't do it at the same time, because with it, the whole thing about a tummy tuck is bringing that scar low, and you bring that scar low by keeping the lower incision anchored and undermining the upper incision. So the upper incision comes down to meet the lower incision rather than them meeting in the middle if you undermine them both. So you don't undermine the lower incision, you only undermine the upper incision, so it comes down. If you start doing stuff to the mons, which means undermining south, that can make that scar more lax, if that makes sense. I'm not sure if I'm making sense here. And it can make the scar migrate up. So you get a scar that migrates up, which can be a problem. And so that's why we try and avoid doing significant amounts to the mons. Having said that, you can do stuff to the mons. You can do liposuction, and you can take a wedge out. So you can have a go at it, no question about it. You can try and improve the mons or the mound, but I can sort of understand if you're seeing maybe people who are perhaps disappointed and think, what have you put that there and why haven't you sorted that out? Because it is hard to really go at it and focus on it too hard when you're doing a tummy tuck, because you don't want to undermine too much down south. So yeah, it is a limitation, and it is a challenge of the procedure for people who have a very totic mons CD. So I think it is, and what a lot of surgery is about patient expectation. So ideally you try and have this conversation with patients pre-op rather than post-op. They say, what's that there? And you say, oh, that was there all along, didn't you see it? And like, oh, you need another operation, and then they get cheesed off. So Nikki says, you're into boobs and bodies, lol. You're right, Nikki, you're right. That is what I do. That is my forte. Seeley, no, not Botox. Talking about the boob and tummy lift and include the lady area. Hashtag that's good too. Thanks and apology for my ignorance. It's not ignorance. No, that's just words, isn't it? It's just calling it mons or mound. Yeah. No. I think I'm assuming you mean the mound is the mons, so the where the pubic hair is. I'm using that to demonstrate it. Not quite sure. Well, anyway, yeah, good. So good. And Seeley, I've got to be honest with you. Don't apologise. You're asking a question, girl. That's what we need. Get some questions going on. That's what it's all about. Yeah. So, I mean, look at these questions I'm getting, Seeley. These are the questions they're giving me. Was that not asked last week? Can someone check me on this? Did I answer this question last week? Who was there? Was I? I'm sure I answered this. Anyway, I remember it. I've got to try and think of a different angle, or maybe there'll be different people. Anyway, why can't combined surgeries go ahead? So combined surgeries can't go ahead because of two reasons. Number one reason is that we are limiting the amount of time in the. Oh God, that's two questions. The next question is, what's the maximum time slot for surgery? Flipping it, I'm answering two questions in one. So the maximum time slot is 3 to 4 hours, depending on the hospital. So this is something that's been imposed because of COVID. So the combined surgeries, the classic combined surgery, is your mummy makeover, is your breast and tummy procedure, which was relatively common, not massively common, but relatively common. A lot of patients opted to have both done in one go. And at the moment, we can't do them both in one go because they take too long, basically. And we are trying to limit the length of time in theatre because we don't want patients having higher risk operations that might then potentially require the NHS. We don't want to put any pressure on the NHS. So that is one reason that we don't want to put pressure on the NHS. The other reason is that there's some evidence to suggest that if you have surgery and then go on to get COVID, you're going to get a worse outcome from your COVID if you've had surgery, and it's worse the bigger the operation you've had, and it's worse the iller you are. So if you're a poorer anesthetic risk, if you've got comorbidities, if you've got medical problems, then you're going to have a worse outcome from your COVID if you get COVID in the immediate post-operative period. Therefore, we're being encouraged not to operate on people who have got comorbidities, who have got other medical problems, and not to do longer operations. So that's two reasons why we don't do combined surgeries at the moment, although I've seen quite a lot of patients in the clinic who want combined surgeries, and we've actually got people waiting since March, believe it or not. Yes, you heard me, March last year. Yeah, so we got patients March last year. So and what I say to them, you either split it, but I understand you might not want to split it, and so if you don't want to split it, I think it will come back. It has to come back, doesn't it? They have to let us do it at some time. I don't know when, but I'm assuming it will come back at some time. So if you really do want your mummy makeover, I think at some point they will be letting us do it again. But you know, hopefully soon, as all this sort of, you know, things getting better type stuff. Candice says, I'm looking smooth. Have you had Botox? Ooh. Do you think I had Botox on myself? I mean, it is. Now I look at myself, to be honest with you, it does look smooth. I think it's bald, Candice, rather than smooth. I think bald is the word you want. But no is the answer to that. I haven't Botoxed myself. I haven't practiced on myself. All natural. This is Candice, all natural. Yeah. So yeah. So so good. That's that one. And maximum time for surgery. Already answered it. 4 hours. 3 to 4 hours. Right. Why don't you do rhinoplasty procedures? Is it the preference of the surgeon, or are they not qualified to do nose procedures? I like this sort of question. I get stuck in. And do you know why I get stuck into this sort of question, Kim? Do you know why? Well, I'll tell you why. That's why, Kim. Yeah, you know what I'm talking about, right? That's why, because I've written a book about this stuff. You know, are they not qualified to do nose procedures? I've got to be honest with you, people, public, right? Members of the public here, newsflash here. You don't have to be qualified to do a nose procedure. Fact, anyone can do a nose procedure. Right? There's no thing that says you need to have a certain whatever to do a nose procedure. Therefore, anyone can do nose procedures. I can do nose procedures. ENT surgeons can do nose procedures. General surgeons can do nose procedures. Max fax surgeons can do nose procedures. Even you know, heart surgeon. If you wanted, to, and as long as he didn't say to you he's a nose surgeon, if he said I'm a heart surgeon, but I'll do your nose procedure, you know, GPs can do nose procedures, dermatology, anyone. This is a problem, people. That's why I've written the book. There is no law or, you know, nothing stopping anyone doing anything. And one of the problems, particularly with plastic surgery, is that because it is quite popular in the private sector, all sorts of people do it. So never mind people who aren't qualified to do nose procedures. First of all, there's no qualification in nose procedures, so there isn't such a thing. There's a qualification in plastic surgery, but it's people who aren't even qualified in plastic surgery will do it. You know, can do it. There's nothing to stop them. So it is, I do think it is a bit of a shocker when you think about it, that there is no real law or anything stopping anyone doing anything. Now, if you go to one of the big private hospitals, your Spire, your BMI, they do restrict the surgeons that can work there. So you have to be on the specialist register for something. So you have to be a specialist in something, whether that be heart surgery or ENT surgery or general surgery or plastic surgery. So that at least if you go to one of those hospitals, Ramsey, BMI, Spire, you know that surgeon has finished their training and is fully trained in something. But you could have a surgeon that is trained in hand surgery, or at least that their subspecialty, you know, plastic surgeon whose special subspecialty interest is hands, doing breasts, doing noses, doing, you know, tummy tucks. So so in answer to your question, it is not because we are not qualified to do nose procedures. We are all qualified to do nose procedures because we're all consultant plastic surgeons who have finished our training and can happily do nose procedures. Well, I wouldn't happily do it. I'd be quite unhappy to do it, but the others would be happily do it. The main reason why we don't do rhinoplasty is two things. First of all, I think the clinic is focused on breast and body, and we are specialists in breast and body. We are not generalists. If you want Botox, I mean, we do Botox at the clinic, but if you want, Botox and nose and facelifts and etc., that is not our specialty. Go to someone that's their specialty. And the second thing is, particularly for nose procedures or rhinoplasty, it is a very nuanced area. It's a very difficult area, if you like. I always say to people, there's no such thing as a difficult operation. There's operations you can do and operations you can't do. And if you can't do it, it's difficult. But it's something that you really don't want someone who just dabbles. You want someone who's experienced in nose procedures, really, or in rhinoplasties. I don't know why I'm calling it nose procedures, just because the question said it. I don't know. You really want someone who's experienced in rhinoplasties to do it. And so that's why we don't really do rhinoplasty. Breast and body, come on in. Nose, nah, not so much. Yeah, that's why. But it is a shocker in terms of the qualified question, because yeah, if I wanted to just say, I'll do noses, I'll do eyes, I'll do facelifts, I can do anything I want. I don't need a certificate or most people think, oh, you need a certificate or a training in nose procedures. No, you don't. You don't need nothing. I mean, God, don't start me on Botox. Are you going to start me on Botox? Fillers. Oh my good God. You don't need anything. You don't need anything to do your Botox and your fillers. Now, if you're going to work in a CQC registered facility, then hopefully they would have some checks, but everyone and his uncle is doing those sorts of things. So that's even worse than surgery, to be honest with you. The non-surgical world, that is, I am sorry to say, the wild, wild west. Surgical procedures is bad enough, but the non-surgicals is. So my thing has always been, a lot of people say they should legislate. There should be a law to say that only nose people should do nose procedures, blah, blah, blah. Yeah, okay, I'm okay with that, but there isn't one, and I don't know when there's one coming. So I would say what I'm doing is I'm educating. That's what I'm doing right here, guys. I am trying to educate the public to say, look, anyone can do a nose procedure. Just because they've got a white coat and they're in a nice building and they look nice, and they might even call themselves plastic surgeons. They can call themselves plastic surgeons even if they're not plastic surgeons. I see it all the time. So you've got to educate yourself. You've got to do your research. You've got to look for the training, look to see if they're on the specialist register with a GMC, which you can check on. It's just the public stuff. It's not easy to do. It's not difficult, but you have to go to the GMC website, put their GMC number in or their name. If they've got a funny name like me, you'll be all right. But if they've got, if they've got a normal name, you might need their GMC number. We're all encouraged to share our GMC numbers. It's nothing secret, so you should be able to ask them what their GMC number is. But you need to do your research. You need to see what is your niche, what do you specialize in. Can I see some results, some of your results of surgery? You need to be aware, and you need to ask the questions. I checked your number. 411-7214 is my number. Okay, my GMC number, 411-7214. But as I say, Staiano, I don't think there's many Staianos out there. So you can just check on my name. But yeah, my GMC number is 411-7214. So by all means, check on the GMC, because I am fully registered plastic surgeon, fully trained specialist fellowship in plastic surgery. So what is kicking off? What's going on? So Instagram, Natty, thanks for fab consultation yesterday. Forgot to ask. I'll obviously take nipple piercings out, but will I be able to put them back in once I've been to dressing clinic and dressings are off? Yes, is the answer to that. Yes, you can take your nipple piercings out, and to be honest with you, you can put your nipple piercings back in again straight away once you've had the surgery. So it's just the metal that we don't like. So actually sometimes people put silicone, or not silicone, like plastic, basically plastic ones in. So if you're worried about your nipple piercings or any piercings, you can use spacers, or like plastic ones. But or just take them out before the surgery, and then you can put them back in after surgery. So, but certainly once the dressings come off, you can definitely put them in. But you can usually the dressings are usually not obscuring your nipples. I checked your number. Good, well done, Kim. Well done, you. Where are we up to? Oh my God, we've got questions. Ask JJ. Yes, that's what I meant. Blimey, O'Reilly. It's kicked off. It's all gone off on Facebook. Hashtag Ask JJ. Nice. We're getting there, guys. We're getting there. Do you do thigh lifts? In a advocate for my group OBS, and not planning all this surgery, but want to share the knowledge. I've not seen a single thigh lift yet that is natural. Good question, Seeley. And I've got to be honest with you, Seeley. Well, the answer to that is yes, I do thigh lifts, and it is interesting. And I think what you'll find if you look on the internet. In terms of body contouring, so I say I do breast and body contouring is my thing, but in terms of body contouring, I've got to be honest with you, that is mainly tummy tucks. I do arm lifts, I do thigh lifts, and you're absolutely right. If you look on the internet for photos of thigh lifts, for arm lifts, you're not going to find many, and you've got to ask yourself, why is that? Why is there loads of photos of tummy tucks, loads of photos of breast lifts, of face lifts, face lifts, breast lifts, and tummy tucks are really popular contouring and skin tightening procedures. Arm lifts and thigh lifts are not popular. Why? And I'll tell you why. And the reason is it's difficult it's a difficult balance with a thigh lift. And there's two ways you can do a thigh lift. There's one way where you can hide the scar up in a groin, which means the scar's hidden, which is great, just like tummy tuck scars and facelift scars and breast lift scars are hidden. But the problem with it, the vector of pull is upwards. Whereas if you have someone who needs a thigh lift, often they pinch their thighs side to side in a circumferential direction and say, I've got all this fat here. Whereas with a thigh lift, which gives you a scar up in the groin, it pulls the skin up. So it doesn't give a significant lift. So personally, and this is a personal thing, there are people out there who do it and get good results. I don't like it, and I don't get good results from it, quite frankly. I think the better thigh lift is by taking a skin in an up-down direction, which gives you a big long scar down the medial aspect of your thigh, all the way down to just above your knee. And that means you can get a really good thigh lift. But it gives you a really obvious scar. So it's not like a tummy tuck, it's not like a mastopexy, it's not like a facelift. It's not this hidden scar that plastic surgeons are great, and they hide the scar and you can't see about anything done. It's and a lot of people say, I hate my thighs, I can't show my thighs in public, they're terrible. Now, if I give you a big long scar down the medial aspect of your thigh, maybe you're going to still hate your thighs because you've got a big long scar there, and maybe you still don't want to take it out in public. So that is the problem with thigh lift, that the scar is a bit more obvious. Same with the arm lift, it's a big long scar down your arm and it's a bit more obvious. And so that is why they're not as popular. So I say this to everybody, and a lot of people say, oh, crikey, I don't want a big long scar, I want the hidden one. I'm like, well, the hidden one doesn't give you a very good lift, and I wouldn't do it. And they're like, oh, all right then, see ya. And I'll be like, sorry, thank you, bye. It's I don't try and sell it because I want to have a happy patient, and it's really hard. And I think that for me, the best thigh lift is the big up and down one, but it's a big long scar. What can I say? But that's a good point, Seeley. Candice, what have you said? Can you use thigh lifts to get rid of stretch marks? You and your stretch marks. So yes, you can, but I wouldn't, because it'll give you a big long scar, and that big long scar will probably be more obvious in your stretch marks, and it only takes an ellipse of skin in the medial thigh. So if you happen to have stretch marks in that area, then yes, but it's a bit extreme, Candice. It's a bit extreme, and I've got to say it's not a good indication for a thigh lift, because it's going to trade it for a scar, and the scar, as I say, is probably going to be more obvious in your stretch mark. So not a great indication, I would say, but it would take out that skin. Seeley, would you have a tummy tuck with a surgeon with grandfather rights? Would you think it's still safe? If not FRACS, but experience? Yes. So Seeley, let me explain to the viewers what that means. So I think what you mean by grandfather rights is what I'm talking about in terms of specialist fellowship is FRCS PLAST. So FRCS plast. Yeah, where is it? Yeah, there. FRCS plast after your name, yeah? FRCS plast. So that means you've got the specialist fellowship in plastic surgery. Now, the specialist fellowship in plastic surgery has only been going for a certain number of years. I don't know how many, but older surgeons, more senior surgeons, may have been around in a time before the FRCS plast. So there may be people who are fully trained plastic surgeons who haven't got the FRCS plast. So what I say to people is look for people with the FRCS plast. That means they've got a specialist fellowship. That must mean they're fully trained. So there may be circumstances where they are not. So that's why you have to do your. So particularly if they're older, if they're young and they haven't got their FRCS plast, then they're probably not fully trained. But certainly if they're older, if they're more senior, not like youngsters like me, then perhaps the other thing is you could do is look at BARPS and BAPRAS. So BARPS, BAAPS, and BAPRAS, BAPRAS, are the plastic surgery associations. So you have to be a fully trained plastic surgeon to be a member of those associations. Now that doesn't mean that if they're not a member, they're not a plastic surgeon, because not all plastic surgeons are members. It's a sort of voluntary. But what it does mean, if they are a member, then they are fully trained plastic surgeon. So that's another thing you can do. So FRACS, I think that's Australian, isn't it? Or Australian, New Zealand. And that is, yes. So the FRACS, is it Australia? And is it, they still have they still have a specialist fellowship. And so that would be fine. But experience, I mean, I think experience is important. I don't think you should just go on training. You should go on experience and say how long you've been doing this. And you know what I always say, if they're a plastic surgeon in the NHS, then that is a marker. If they are or have been, and experience is extremely important. Yes. And do you get on with them? Do they have good results? There's also all sorts of good photos, happy patients. There's all sorts of reasons to choose a surgeon. It's not just on the training, but and the main thing I say about the training is it's okay for people who aren't plastic surgeons to do a lot of the stuff. ENT surgeons, maxillary surgeons do rhinoplasties. They might do facelifts. It's okay. That's not a problem. But they might be trained in it and fine with it. That's absolutely fine. The problem, as I see it, is when you think they're a plastic surgeon. And I think a lot of people think that people are plastic surgeons, whether they've been told outright they're a plastic surgeon or whether they've just implied it when they're not. And I think a lot of, that's the thing. It is, there are people out there who are not plastic surgeons, who people perceive to be plastic surgeons, who are fully trained plastic surgeons, and they're not. And it often comes to light when they've had a problem and they have a botch or something like that. And they say, oh, my surgeon wasn't trained and it's all terrible. I'm like, well, yes, I agree, that is terrible, but that's why you need to look and see if your surgeon's trained. Kanye West's mum, Donda West, she was his manager. She died after having, I think, a mummy makeover, and I think her surgeon wasn't board certified, which is the American equivalent, wasn't fully trained, as was Usher's wife's surgeon, who had liposuction. I think she had a PE or DVT or something. So these big names, Colin Hendry, the footballer, Premier League footballer, playing for Scotland or something, or anyway, his wife had abdominal liposuction, and so by a non-plastic surgeon. So there's examples of people who are very, obviously money's not a problem, very prominent, having surgery from non-fully trained surgeons, and they obviously thought that they were having trained surgeons operating on them because there was obviously a nice website and a nice whatever to make them think that, but you have to do your research. That is what I'm trying to say. So Julia says good evening. I'm going to say good evening back to you, Julia. Celia has gone crazy with the Ask JJs. It's just gone mental. I'm asking because I trust your opinion. Honestly, your reputation carries you massively and I respect that, but I'm interested in your opinion. You hear that? Let me just repeat that for the Instagram people who didn't hear it. I trust you, your opinion. Honestly, your reputation carries you massively. This guy's got a reputation. Thank you, CV. Very good of you to say. Checks in the post. Right, Nikki. Hashtag Ask JJ. That's what I'm talking about. Boob Uplift. 36E. Saggy. Due to 100 pounds weight loss. Well done, you. Would I get a good lasting result from just an uplift, or would I need an implant? Would I then go down cup sizes, or it just reshape? Good question, Nikki. That's what I'm talking about. Come on Instagram. Let's have some questions like that. That's a nice question. Good one. Yeah, I would say you get a good uplift result. I'd say normally there's uplifts and there's shape and there's size. And if shape's the issue, lift. That's it. Done. If size is the issue, if you're like, I'm an E and I don't want to be an E, then, well, if you want to be smaller, then it's a reduction. And if you want to be bigger, then it's implants. So I think implants are really good if you're like, I'm an E and I want to be bigger than an E. I wouldn't, but, it's just, that. But if you're happy with the size, after a lift, broadly speaking, you're about the same size. Now, you do take some skin out. So there is a small loss of volume, but not significant. And actually, the bigger your breasts are, the more they're acted on by gravity. So taking some volume out can actually be good when you do a lift to make them less likely to droop in the future. But I wouldn't recommend an implant if you don't want to be bigger. Having said that, you have to be comfortable with the shape that you can achieve with a lift. And this is something I go to great lengths to demonstrate to people, because when you have a lift, they're like that, and you're like, oh yeah, they're great, fantastic, or whatever, or you might think, oh God, what have you done? But in time, they settle. They settle to a bit more of a concavity in the upper pole out of a bra. Now, you can wear a bra and push them up and stuff, but you might say, well, you can do that now. But there is a bit of a concavity in the upper pole when you're using your natural breast tissue. The only way to get sustained fullness in the upper pole, to get it to stay up there, is with an implant. But as I say, the implants will make the breast bigger. And I'm not a big fan of this reducing the breast down and then using an implant to give that fullness to maintain the volume, although that is a technique. But I'd say well done on the weight loss. I think you would get a good result from an uplift, although you'd have to be comfortable with what you mean by a good lasting result, because as I say, when you first have it done like that, but in time it does settle because it's natural tissue and that tissue has been stretched. We can't give the tissue back any elasticity. It's lost its elasticity because of the weight loss, because it's been stretched, and so it will naturally form what I would say is a more natural result. But a lot of people say, oh, I don't want it to droop again, I don't want it always droopy and all this, paid all this money for a lift. I'm like, you've got to be comfortable with that shape. And if you're not comfortable, then an implant can give you fullness up there, but as I say, it'll make your breast bigger. Liz Crazy, ask JJ, hashtag ask JJ, look at that. Do you recommend taking Arnica before and or after tummy tuck surgery? I've been giving mixed response from people. You know what, Liz, it's an interesting question. Someone asked me this in the clinic yesterday. I don't, Liz. I don't recommend it, but perhaps I should. And the reason I don't recommend it is because bruising isn't that much of an issue. Having said that, I saw someone was it yesterday? God, the times. Anyway, recently, and she had quite a lot of bruising. She had a breast reduction. There's quite a lot of bruising. I think, oh, crikey, it's quite a lot of bruising there. So maybe I should. I don't think it'll do any harm. I don't know if it's scientific that it helps with bruising, but I don't recommend it. No. In terms of the tummy tuck, you do get bruising with the lipo. If you're having lipo to the sides, then you do get bruising. But in terms of tummy tuck without a lipo, then it is often not significant. Bruising is not a significant feature. And what I would say to you, Liz, is there's no harm in it. I don't actively encourage people to do it, but there's no harm in it. Perhaps I should start actively encourage people to do it, see what happens, and then I'd know whether to do it or not. The problem is bruising is not a major problem, you see, so it's hard to know whether it's healthy or not. You probably need quite a big sample size to show a difference. But yeah, no harm in it, Liz, no harm in it. Seeley, thank you for that tonic. Are normally Barry, but moved into plastics this week. That's a coded message just between me and Seeley. Only we know what that means. Actually, maybe Seeley, I'm sure they are great, but worries me when I can't search a member's surgeon. Yeah, you need to search them up, Seeley. You need to search them up, girlfriend. So, oh look, hold on. My private journey, what you got? The bruises fade quickly enough. Plus, I got loads of sympathy for my husband. Yeah, you're right, actually. The bruise is usually a week or so, isn't it? Was it a week or so? Usually a week or so, 3. And good for the sympathy vote. But yeah, maybe if I think it helps, I don't know. I don't know. But yeah, good point. Bruises is not normally much of a sort of problem, if you like. I had a breast lift with implants. I'm currently 4 months post-op. Should one boob be bigger than the other and nipple line not matching, or do I just have a botched boob job? First thing I'm going to say, this isn't my patient, so it's not. I mean, not that it could be my patient. I'm not saying this couldn't be my patient, but it isn't. But good question. And it's tricky. I normally say, well, the first thing to say is talk to your surgeon. It's always best to talk to your surgeon. Your surgeon knows what went on, whether they did more on one side, whether they had to do things in terms of the fold and the heights of the nipples, etc. 4 months post-op is early days. I normally say things start to settle around 3 months, start to settle. And it can take 6 months, 12 months, even 18 months to properly settle. So 4 months is just starting, really. So I wouldn't be overly doom and gloom and worried about it. I certainly wouldn't start writing yourself into another operation or anything like that. A lot of people do that. They sort of think it's all going to be bad, and it's almost like they don't want it to be good once they get into such a negative mindset. So try and keep a positive mindset. One boob bigger than the other. So a breast lift with implants is a big deal. It's a big op and it does knock you out. So it's not uncommon for one breast to be bigger than the other in terms of swelling. Now, and also nipple line not matching. What I'd like to do with that is I would like to look at the pre-op, because often the nipple line is not matching pre-op and you don't notice it. People that don't notice it pre-op. Mind you, if you had a lift, that could be evened. If you have just implants, then that nipple line will be the same. Yes, with a lift, that nipple line could be evened up. But the problem with this sort of stuff is that when you've had surgery, you're very critical, if that's the right word, I'm not sure, but you're sort of analyzing, hold on a minute, this breast is bigger, this nipple's not quite level, understandably so, because it's very expensive and you spend a lot of money, you've invested a lot of time, a lot of energy, a lot of research, big deal, life event. I mean, I'm not saying it's wrong, I'm just saying you do tend to be very critical, or one does, after surgery, whatever you have done. And we often see people who come back and say, wait a minute, this one's bigger than this one, this nipple, this little, and I'm like, oh yeah, that is a bit bigger. Yeah, nipple's not quite right. That's okay. Well, it's 4 months. Let's give it a couple of months. Let's see how it goes. And the more time you give it and the more you learn to live with them, not only will they settle, because they will settle. So that's the first thing. But also as you learn to live with them, I sometimes say to you in the clinic before you sort of examine you, well, one was a bit bigger than the other, wasn't it? Which one was it? And they're like, oh, can't remember. Have to look, so it becomes less of an issue. So as time goes on, time heals all wounds, as time goes on, not only does it settle, but also I think you learn to live with it a bit more. There's a combination. So I wouldn't be too worried at 4 months. I think it does take time for it to settle. And what I normally say to people is that this is not your final result. If people say things, usually often at 6 weeks, they're saying things, a couple of months, 3 months, 4 months. If they're worried that there's issues, I say, look, this is not your final result. I'm not guaranteeing you that it'll settle. I'm not guaranteeing you that it will all work out. I'll give you an opinion. I'll be like, I think it will all work out, because the surgery went pretty well. I was pretty happy with the symmetry and everything, so I think it will all work out, and it usually does. I can't guarantee it, but what I would say to you, if it doesn't work out, I'll fix it. If there's things are not level, or one's a bit bigger than the other, or something like that, if there's something I can do to fix it, I will fix it. But I wouldn't think of that at this stage. I think, you need to leave it as long as possible. And also, the other thing, it depends on the degree of asymmetry, to be honest with you, because you need to wait until your final result, number one. But number two, from a surgical point of view, we want to create a happy patient as soon as possible. So if it's way off, if one nipple's way high and one's way bigger, or one's, if there's an obvious, wow, then you might think of doing surgery a bit sooner. Revision surgery I'm talking about, because you want to have a happier patient soon. If you leave someone for a year or 18 months and they say, oh yeah, that fold, those nipples are a bit, I'll fix the nipple thing, then you're going to have someone who's going to be like a bit annoyed and maybe an unhappy patient. So this is me anyway. So I suppose all surgeons are different, but I want to have a happy patient as soon as possible. So if I think that it's really not going to settle, and I think there's something relatively simple, relatively low risk I can do to fix it, I might be inclined to do a slightly earlier revision if it's a significant asymmetry that I don't think is going to settle. But if it's mild, I think you need to leave it as long as you can to get your best result before you start thinking about having anything done about it, and before you're thinking using terms like botched boob job. Not helpful using terms like that. It's an emotive term, isn't it? So don't say that. Don't say that about your own result. Come on, let's be positive. Got to be positive. Chin up. It's the only result you've got, so you've got to run with it. Let's get it as good as we can get it. Be positive about it, and just focus on the positive aspects of what you've got, and let's just hope that those things settle. That's what I would be saying. That's where I am on that one. And good luck. Fingers crossed. Sounds bad, the surgeon saying fingers crossed, doesn't it? But yeah, it is a bit hands of the gods now. You've got to wait for the settling to settle and see how your body reacts. That's the problem with this surgery. It's a nightmare, this game. I don't think you lot realise what a nightmare it is for us. We're put on this thing like plastic surgeons, and they've botched this and they've done that wrong, and oh my God, look at this, it's all terrible. It's hard sometimes. You're dealing with the body, you're dealing with tissues, you're dealing with, potential for infection, wound healing. There's unpredictable variables. The way I think about it, I don't know whether it's good to share it, but it's late on in the live, so there's many people around. The way I think about it is like gambling. A good gambler will win more often than he loses. That's but a good gambler can't guarantee he's going to win every time. They still lose. Even though the odds are stacked in their favor, if they're a professional gambler or whatever, they're still going to lose sometimes. And I think it's the same with surgery. I don't know if that's a good analogy or not. I don't know if that gives you comfort. But it doesn't matter how good you are or how meticulous you are about your surgery, there's going to be wound healing problems. There's going to be asymmetries. There's going to be infections. There's going to be issues. And for me, I talk to a lot of doctors now about sort of building practice and things. I think it's all about how you deal with the issues. I think being open with patients and telling them that these are the risks beforehand. Anyone's had surgery with me will know that I will tell you that there's a risk of infection, there's a risk of hematoma, there's a risk of problems. Very, very low risk often, and obviously it doesn't happen very often in cosmetic surgery, otherwise it wouldn't be so popular. But any surgeon who tries to tell you that they haven't got any complications and it's all going to be fine, I would run a mile, quite frankly, because they're either not operating or they're not being honest with you, because anyone who does any amount of operating has had problems. And it's not because we're trying to do harm. It's not because we're trying to mess it up and we're trying to make everything wonky and all over the place. I think most people are trying to do their best, to be honest with you, whether they're trained or not. Having said about all the training and all that, I think everybody out there is trying to do their best, and no one is trying to do a bad job. But it's about how you handle it, which is why I find it a little bit upsetting. Is not the right word, but when someone posts a question like this, and I'm not their surgeon, I'm like, well, if I was your surgeon, I wouldn't want you asking another surgeon's opinion, 4 months post-op. I'm like, talk to me, and I get a lot of that. I get a lot of people who message me and send photos. I'm okay. I'm not complaining. I'll help if I can. I'll give you my opinion, but I will always say to them, look, you're better off with your surgeon. I don't know what you had done. I don't know how tight it was, or whether I struggled on one side, so therefore it's a bit more swollen on that side. I don't know what it's hard for me to give you an opinion on things in the early post-operative period. That's really a surgeon. So that's where you need to be focusing your time and working with your surgeon. And when you have got concerns, that's when your surgeon needs to step up. It's a bit like insurance. Another analogy, second analogy of the night here, guys. I hope you're making a note. So we've got the gambling analogy. It's a bit like insurance. You don't know how good it is until you claim. Same with the surgeons. So that's why you've got to be a bit careful, because there's a lot of people out there who look like they're fantastic and great, and hey, who maybe don't look after you that well afterwards. I shouldn't say that because I don't know that for a fact, but I do see a lot of people who ask me for opinions, and I'm thinking, where's your surgeon gone? So it's a bit like if you go sail through, and I'm sure you will sail through because most people do sail through, but what if you don't sail through? What if you have a bit of a bump, bit of a dog ear, bit of a red scar, bit of a scar's not right or level or something like that, you know, you surgeon's got to look after you. It's part of the job, in my view. Okay, all right, all right, I'll stop now. I went off on one. I accept that. Right. What's happened? What's going on the chat? Sorry about that. I want a lot of surgery. Any jobs going? Candice, have a word with yourself. Have a word with yourself. Honestly, you absolutely don't need anything. And no, we haven't got any jobs doing, Candice. Sorry, small team, but always looking to grow. Come on, we want to grow bigger. So, you know, keep it in mind. Never a bad word said about you in all the groups. That's kind. That's kind, Kim. I do my best. I agree with Kim. You know what? And I say, I will say to everybody, I cannot guarantee you're not going to have a problem. You know, I cannot guarantee that. But I can guarantee that if you have a problem, we will look after you and we will give you the best result possible. I will do everything I can to give you the best result possible. And that's my mantra. That's why I try. And, you know, and I think that's where a lot of people get unhappy patients, because I often, you got me on a topic here now. I often will see people who will come to the clinic and they will badmouth their surgeon. They were terrible. They're and they look after me, and they were a cowboy, and all this. Like, I'm giving it all this, like it's all terrible. I'm thinking, oh my God, what terrible. And then I'll say, okay, well, I'll examine you and see what. And I look and I think, do you know what? It's not that bad. The result's actually not that bad. And I think the problem is that surgeon hasn't looked after them properly, and that's why they're bad mouthing. And I see it myself in other areas of customer care. You know, when you buy something, you know, if you looked after, you're much less likely to turn into a ranting, oh, I'm so angry. You know, if you're not looked after, that's when you go crazy and you start saying that surgeon's terrible and everything, because they're not looking after you properly. I think that's where a lot of the problem comes. Communication, looking after people, listening to people, yes, the fold's not right, let's have a look. Oh yeah, that fold is a bit higher. Do you know what? I did a bit of work on that one, so I think that's actually swelling. And I think when that swelling goes down, maybe, you know, looking after people, getting them through. This surgery is often quite traumatic. You don't get your final result straight away. It's a journey. You know, it is a journey, and you don't, you know, you have to get people through that journey, and it can be quite stressful, because you've saved up all your money and you've spent years considering it and you've researched to the hilt, and then you have it done and you think, oh my Lord, one's up, one's down, what's going on here? It's all gone wrong. You have to keep people close, and you have to keep looking after people. Sorry. Oh, I'll stop now. Right, what's going on? Sorry. Anyway. That's what I agree with Kim. I agree with Kim too. BA Journey. Why are general surgeons on the GMC allowed to perform plastic surgery if they're not technically qualified? Sorry if it's just been asked before. I'm just interested. Well, because what's stopping them, BA Journey? What's stopping them? That's the problem. People think there's some kind of law that when you go into theatre, someone says, wait a minute, can I stop you there, please? Can I just see that you're a plastic surgeon doing these operations? Anyone can do it, not just general surgeons. Anyone can do any surgery, any sort of plastic surgery, if you like. There's no law. And the thing about general surgeons often do breast surgery as well, which is slightly confusing. They normally do sort of the cancer side. So if you have a breast lump, if you have a breast cancer or anything like that, you'd see a breast surgeon, not a general surgeon. Not a plastic surgeon. So there are general breast surgeons, if that makes sense. So that makes it even more confusing. So there are general surgeons, and there are general surgeons who have spent time with plastic surgeons learning about reconstruction in terms of breast cancer, and these are so-called oncoplastic surgeons. So they've got plastic in their name. They're general surgeons, but they call themselves oncoplastic. So it is a bit of a grey area that who says what operation you're allowed to do. You know, and certainly in plastic surgery, because plastic surgery spans a lot of body parts, body areas. We operate on any part of the body. It's not like heart surgery. You know, you're not going to get anyone else doing heart surgery. It's just heart surgeons. You're not going to get. And I think the combination of the fact that there's lots of body parts involved together with the fact there's a lot of private work where people are searching the internet for surgeons, that leaves it open for surgeons who aren't qualified to say, I'll do that. In a lot of other operations like heart surgery, brain surgery, hip replacement, stuff like that, you go to your GP and your GP will refer you into the hospital, and then you might still choose to have it done privately, or your GP will refer you on to a surgeon that they know. So it's only fully qualified people who go through that pathway, because a GP knows all the fully qualified people. And that's plastic surgery. People don't go through their GP, don't go through a GP recommendation. They go for the internet, they go for Google, they go for things like that. So that's why plastic surgery has opened itself up to people who aren't trained, slash might be trained in something else. So there's people who aren't trained in anything at all, and then people who are trained in other things, doing other, working on other areas. And as I say, it might be okay. You might have a general surgeon who's trained in breast reconstruction, who's very good at it and very qualified and all that sort of thing. That's fine. The problem I've got, and if they say I'm a general surgeon and I've trained in breast surgery and I've done this and I've done that, and here's some of my results and I've got loads of happy patients, well, that's all right. I'm not saying that's not all right. Same with plastic surgeons who are doing hand surgery or burn surgery, who also do breast or noses or whatever in the private sector. That's fine. It's happening all the time. It's standard. You can't stop it, because most plastic surgeons do everything. It's very rare for plastic surgeons, they say they don't do Botox, or they don't do noses, or they don't do facelifts. I'm quite, there's not many of plastic surgeons who do subspecialized, super specialized like that. Most will do anything, and it's sort of okay. It's okay to do breast surgery, a standard breast augmentation, I guess, if you're not, if that's not your niche. The problem comes when you get an asymmetry, when you get a problem, then maybe you want someone who specializes in breast surgery. But grey area, BA Journey, it's a grey area, my friend. That's one of the reasons I chose you. Realistic but reassuring. That's true. I'm going to write that down. I'm going to get that on the website. Realistic but reassuring. That can be like my strap line. JJ Staiano. Realistic but reassuring. What is going on Facebook? I've missed it. Oh my God. We've done the Barry. Members. Nikki. Sorry, Nikki, to keep you waiting. Sorry to keep you waiting. It's like clinic this, overrunning. Hashtag ask JJ. Nikki, you are. Go for it, girl. Thanks, happy with size and don't want to be bigger, just don't want spaniel ears. It sounds like a lift, Nikki. It sounds like a lift to me. Sounds like a lift to me, but accept the shape will settle, not drop. Don't use the word drop. Drop sounds bad. Settle. Lift, just be happy with that shape. But look at some photos of lifts, Nikki, to check you'd be happy with it. But in my view, I think it's a lift that I would recommend from what you've said there. But obviously, it's not a we need a disclaimer. This is not a what's the word? Substitution for an in-person consultation with a fully qualified plastic surgeon. But just from what you said, that's what I'm thinking. Liz, hashtag ask JJ. Go. I read you can have fat transfer to your bum. Could I get a fat transfer to my boobs instead of implants? If so, what would the results be equal to that of an implant? So Liz, fat transfer to the bum is a little bit dubious at the moment, but fat back transfer to the breast has always been a thing, even when they were doing fat transfer to the bum. So definitely you can get fat transfer to your breast. Fat transfer to your breast is quite an established technique, and a great technique, and a technique that I love, but I hardly ever do. I hardly ever do it for cosmetic augmentation. It's really, the reason being, it's small volume in my hands, Liz. In my hands, it's small volume. So you're looking at maybe 50, maybe 100 mils would be big, to each breast. So that's quite subtle. So in answer to your second part of your question, would the results be equal to that of an implant? Or no? Well, yes, if you were having a 50 to 100 cc implant, but we pretty much never use implants that small. They're usually 250 cc's. So for that reason, fat grafting, fat transfer often has to be repeated, and it's quite expensive. So the results are subtle, it's quite expensive, often need to be repeated. Goes back to patient expectation. So fantastic on paper, because no one wants implants if they don't have to have them, because there are potential risks and problems associated with implants. But in terms of getting a demonstrable increase in the volume of your breast, just like that, implants are still the gold standard. I would love it for fat transfer to be better, because I don't want the long-term problems you can get with implants, and it'd be great to be able to take it from one area and put it into your breast. And it's a great technique, it's a lovely technique to do, but as I say, subtle at the moment, so you'd have to be aware of that. My surgeon to be says he won't know if I'll need an MR, that's muscle repair I think, till he opens me up. Is this correct? I don't want to go against your surgeon, Sarah, your Sarah surgeon. I mean, you can get an assessment of the muscle, but you obviously, when you open you up, you can see exactly. So I think that's fair enough. I mean, usually you can get an assessment, and usually most people, I would say, do need muscle repair, but not everyone. And if that's what he says, Sarah, then fine. Yeah, I mean, I think that's not unreasonable. I mean, when you get I'd say you can assess it pre-op, but there's nothing like seeing it in real life. You can see the muscles there. So yeah, as long as you're all right with your surgeon, apart from that, Candice, does fat transfer cost much more than implant? I think, Candice, it's less than implants, I think, but not much less. I think it's sort of comparable. I think it's like £4,000 or £5,000, I think. I shouldn't mention prices. I think so. I think it's quite expensive, basically. Tracy, I'm changing my implants and having a mummy makeover as my implants are 12 years old. Go for it. I want them smaller and really pert and round at top. Is putting them over the muscle and adding a stitch to keep them pert okay? No. No, Tracy. That's pretty far from okay, Tracy. If you're downsizing your implants and you want them more pert and round at the top, those two things don't go together, girlfriend. So I don't know what the stitch to keep them pert's all about. I mean, it sounds like you need a lift if you want them more pert, or bigger implants, which you obviously don't want. So I'm not suggesting you have bigger implants, but you can't make them more pert and fuller at the top with a smaller implant, unless you've got some kind of teardrop implant and you could change it for a high profile or an extra high profile round, potentially. But that's likely to be bigger, for the given base width, assuming your current implant was put in, of an appropriate base width. For a given base width, a higher profile round implant would have a bigger volume. So making it downsizing and pert don't go together. Downsizing and droopy, I hate to say it, I hate to break it to you, Tracy, I don't want to step on toes. Listen to your surgeon. Don't listen to me. What does this guy know? Talk to your surgeon, and if they've got good results and stuff, and fine. But in my view, think about it yourself. You're putting a smaller implant in. Your skin's been stretched by the implant you got. Without taking any skin out, a smaller implant, your skin's going to droop, isn't it? You have to take skin out. You have to tighten skin. Equals lift. Again, disclaimer. I need the disclaimer. This is not, this is hard without examining you, etc., etc. But this is just in principle. Think of it yourself. Does that make sense? Smaller implant, more pert. As I say, unless the implant you've got is not is very, very wide for your frame and a low profile. I'm trying to think of a way it will work, and then they put one in an appropriate width, but if it was very, no, it's not working for me, Tracy. Not working for me. Didn't sound good. Oh, here we go. And what's your opinion of going for a mummy makeover, for example, Turkey? That's my opinion, Tracy. I don't recommend people go abroad for surgery or go a long way away for surgery, Tracy, for several reasons. I don't think it's great to go abroad because if you have any problems and any issues, will you have access to your surgeon? That's why I get loads of messages, Tracy, because they're like, they haven't got access to their surgeon. They're saying, is this okay? Is this right? And all that. You need to have access to your surgeon to make sure everything's healing okay, whether or not you've got a problem, to be honest with you, because the vast majority of people don't have problems. But they, long term, but often short term, they're concerned about folds and one's bigger than the other and all these things. So that's number one. And number two, the training. I can tell you about training in the UK in terms of looking for FRCS plast, look for BAPRAS, look for BARPs. That's how you find a fully trained surgeon. I got no idea how to find a fully trained surgeon in Turkey. I'm not saying there are any. I'm sure there are some brilliant surgeons in Turkey, but I just don't know what to say. I don't know how to even look for a fully trained surgeon in Turkey. So there are issues with going abroad, Tracy, to be aware of. And the other thing I'd say to you is I understand why. I totally get it. It's expensive having surgery in this country, and it's significantly cheaper abroad. I've seen it. I know it is. And I look at those and I think, how can they do it? We have got such a lot of money we have to spend on our systems, on our processes, on our infection control, on our diligence in terms of paperwork, in terms of ensuring the flow through of theatres, that things are done right and that things are done properly. So it's hard to know how they do it, to be honest with you. In terms of indemnity, we have to have indemnity. We have to be insured as individuals, between £5 and £10 million of insurance, so that you're covered if you do come to harm or have any problems. Then you're covered. I can't just say, oh, sorry, I can't help you. We're backed by insurance policies that will help you. So anyway, do your research, Tracy, is what I'd say, and and good luck. But I'm worried about your smaller implant and stitch to make them pert. That's alarm bells for me. But maybe go and see a surgeon in this country and see what they say, just for an opinion. Thank you, Liz. Thank you, Sarah. We're getting thank yous going on. Hashtag Ask JJ. Thanks, JJ. Much appreciated. Much appreciated to you, Nikki. And Tracy is having an uplift. Oh, sorry, Tracy. Oh, is that the stitch? Oh, well, I retract everything I just said. Oh God, sorry, Tracy. Where did you put that message? Oh well, that's fine, Tracy. Smaller implant, bang on. Oh, I'm okay with it now. Yeah, is that what you meant by stitch? So smaller implant and uplift. Yeah, that's good. That's pert. Yeah, I'm okay now, Tracy. Sorry about that. Sorry about what I said a minute ago. Yeah, that's fine. Is that what you meant by the stitch? I feel like a bit of a fool now. Anyway, it's okay. Right, so Wrinkle Free Man is going to have some dinner and watch last bit of Antiques Road Trip. And if you've got any questions, post them on Facebook, post them on Instagram, email them, or however else you want to do it. This is on YouTube as well. Comment on YouTube. I try and answer all the comments on YouTube. I know I'm a bit behind at the moment, but I try and answer every comment. And I will be back this time next week. See you soon. Thank you, Tracy. Sorry about alarming you earlier on, and you should be fine with the lift. And thank you, Khan. You're still here, Khan. Khan, yes, you stayed the whole time. Thanks, Julia, and enjoy your dinner. Yeah, well, not sure what it'll be. Oh, look, see you soon. Jackie's here, stalwart. Yes, brilliant as always. Brilliant as always. And what's the other thing I need on the website? I've forgotten it already. Tells you the stuff. Reassuring and realistic. Was it reassuring? Anyway, we'll have to go through it. Anyway, good. So I am going to sign off, and I am very much looking forward to seeing you all here next Tuesday night at 7 o'clock. Thanks for coming. Thanks for visiting.